Welcome back to Chapter 4 of the PMU Entrepreneur Bible. If you've made it this far, make sure you click the subscribe button and like and leave a comment because we want to hear what you have to say about the content. And thank you for joining us because you are now accelerating your permanent makeup career and learning the secrets to how to build a better business. Chapter 4 is Client Consultation. A client consultation allows you to pick the right service for clients based on their skin type and your skill level. The consult allows the clients to discover if they're well suited for your studio and what you offer. During the client consultation, it's important that you clarify what they're looking to get done, including any misconceptions and expectations that they have about the procedure. This is your time to determine if the client is a good candidate for the treatment and also suggest any alternatives if they are necessary. This is how you're going to build trust with your client, as the goal of the relationship is to eventually develop it beyond a single service type. Clients need to feel comfortable with you and your space because you're tattooing their most prominent body part, sometimes with their eyes closed or mouth guarded. Though PMU is considered semi-permanent and fades, that can take years to occur and be painful if it's done with various tattoo removal methods. A consultation can make the client feel more relaxed when returning to get the tattoo performed now that they're more familiar with the artist and their space. This can turn a nervous, difficult client into a more pleasant patron. Client consultations can occur virtually or in person. Since COVID, the beauty of virtual meetings is that most people are familiar with different resources like Zoom, Facebook Messenger, or FaceTime. If you offer virtual consultations, make sure you're able to see the area that you're tattooing clearly without any makeup on, and ask the client to share selfies with good lighting that show the area that you're tattooing. The benefit of in-person consultations is that you're able to pre-draw sometimes for the client to show them the shape. But don't spend too much time offering that option during the consultation because that shape may change the day that you perform the tattoo procedure and can add unnecessary time to the surface, even if you include this consultation time into the consultation fee. Have the client share a photograph of their dream look, whether that be the eyebrows, eyeliner, or lip color that they have once worn or that of a celebrity. If you're having a consultation with the client prior to the procedure, you should also be asking them about their lifestyle around the time that they're having the tattoo done and any medical history to see if they have any contraindications that would make them a poor candidate for a permanent makeup procedure. For example, if the client has an upcoming marathon or they're going on vacation to Mexico, it would be best that they wait and have their permanent makeup done after those events have taken place. If the client has been on Accutane, they need to wait at least 6 months to a year or more before having any type of PMU treatment. If your client works in healthcare, alert them that there may be an increased risk automatically of infection just to potential environmental exposure in the workplace. What's the client's grooming routine in the area being tattooed? These are important things to know prior to beginning the session once you and the client can't turn back. Remember that it's okay not to take a client or to fire a client. Not every client is going to be your client. If the client has unrealistic expectations or is being difficult during the consultation, it most likely will not improve after you begin performing the service. Cut your losses early and learn to cultivate a clientele of people that you enjoy working with, and those people will help you find more people through client referrals and word of mouth faster than working with every single client just to make ends meet. Remember that during the consultation, to listen to the client more than you speak, even if they're unsure how to explain what they desire after seeing photos online. A really intriguing statement I heard years ago was that listen and silent have the same letters for a reason. There's also a statement I heard years ago that the old adage is you have 2 ears and 1 mouth, so you should listen twice as much as you speak. While the client wants to know and understand our expertise and what we suggest for them, we have to truly hear what they are looking for before we can offer our honest input. Never make promises to a client. Tattoo is an art and a science. Individual, human, and environmental factors also influence how your work will heal and if it ages well in years to come. This is especially true for clients receiving a paramedical or scar camouflage tattoo that may have more challenging skin due to scar tissue. The medical history that you take during a tattoo or PMU procedure is so extensive, it earned its own chapter later on in the audiobook, but it's important to ask the client if they're pregnant or plan to become pregnant and will be breastfeeding during the procedure and at the touch-up in 6 to 8 weeks. Hormones produced during pregnancy can severely decrease ink retention. Often people believe that pregnant and breastfeeding women shouldn't be tattooed due to the risk of bloodborne pathogen contamination, which is always a risk and should not be any more of a concern if you are practicing with aseptic technique for each client. If the client tans, tell them to stop and avoid burning or sun damage prior to the service, and that they will need to stop sun exposure during the aftercare period. Quiz the client about their nighttime skincare routine to discover if they use any retinol or glycolic acid around the treatment area, and that the application of these creams can cause redness and skin irritation that will mimic an allergy or infectious reaction if they use it during the aftercare period. If the client receives any med spa treatments like IPL lasers or Botox, you'll have to find out and remind them not to receive any services at least 2 to 4 weeks before or immediately after while healing from PMU. Don't forget to verify that the client is over 18 years of age. Believe it or not, some 17-year-old clients pass for early 20s, and you don't want to find yourself tattooing a minor, especially when it's illegal in most states unless you have a notarized consent form or a parent present for the consent. While this can be a sensitive subject, make sure you're asking the client specific motivations as to why they want permanent makeup or paramedical tattoo treatments performed. Is the client suffering from body dysmorphia? Is the client pointing out body parts unrelated to the procedure? Is the client making critical comments about their body parts or areas to be tattooed? Has the client mentioned other studios that have denied procedures to them or artists that no longer work with them? Does the client appear to be under the influence of drugs or alcohol? Has the client already had multiple procedures but still wants more done? Has the client suffered a recent loss, whether it be a death or a dramatic life-changing situation? While we're not clinical experts and cannot give clients advice, it's important to make reasonable observations and ask relevant questions that help you determine if the client truly understands what they're asking you to perform for them. It's also important to warn the client of any potential complications so that they are prepared if things do not go ideally. A majority of the consultation process is managing the client's expectations of the end result. While this seems like it can take a long time, a good client consultation should only take 15 to 20 minutes, several days or weeks before the service at the beginning of the service. As lovely as a client may be, we are not auditioning to be their new best friend, so it's important to keep the consultation brief and remind the client that you will speak more when they return for the service. This will help you prevent an overly chatty Kathy. Also, make sure to do yourself a favor and take a deposit from the client before they leave to book their future appointment. Never let a client leave an interaction with